This is my paperwork for the head to toe assessment. Okay. Hi, I'm Marla Contreras. I'm a nursing student at Texas Tech, and I will be providing your head to toe assessment today, if that's okay with you.
Yes, of course.
Okay, can I start with your name and date of birth?
Joanna Contreras, August 3rd, 1993.
Okay, I'm going to provide patient privacy, and I'm going to go ahead and do hand hygiene and put my gloves on. And this is the time where I would also lift the bed for my patient. Okay, I'm going to start by touching your skin if that's okay with you.
Okay, that's fine.
Okay, I can see your hands. Okay, skin color is uniform, warm to touch and dry, with no lesions noted. Now I'm gonna go ahead and check for tenting. No tenting noted. I'm gonna check the nails. No clubbing. Nail hygiene is clean and adequate. And capillary refill is less than 2 seconds bilaterally. I'm gonna go ahead and check the head. Is it okay if I touch your head?
Yes, of course.
Let me know if you have any tenderness, okay?
No.
No tenderness noted. Hair is well groomed. Hair is evenly distributed. No pediculosis, no protrusions or indentations noted. I'm gonna go ahead and check your jaw. You can go ahead and open, close your mouth. Temporomandibular joint is free from crepitus if you can clench your teeth. Okay, temporalis and crepitere muscles are equally strong. Cranial nerve number 5, trigeminal nerve is intact. Now I'm gonna go ahead and do the light touch. If you can let me know if you feel this, please close your eyes. Do you feel that?
Yes.
Do you feel this?
Yes.
Light touch noted. Cranial nerve 5, trigeminal nerve is intact. I'm gonna go ahead and check your sinuses. Do you feel any tenderness?
No.
Okay. Do you feel any tenderness?
No.
Temporal and maxillary sinuses are non-tender. If you can go ahead and we're going to test your facial cranial nerves, so if you can smile, frown, puff your cheeks, and raise your eyebrows. Okay. Okay, cranial nerve 7, facial nerve intact. Now we're going to go on to the eyes. I'm going to check the external. Eyebrows are symmetrical. Eyelids are intact. Eyelashes evenly distributed. And no redness or swelling in the eyes. Now I'm going to check the internal. Conjunctiva is pink, moist, no excessive tearing. Iris is round, sclera is white, and no lesions noted. I'm going to go ahead and check the corneal light reflex. You can look straight for me. Okay. Corneal light reflex is intact. If you can follow my pen as it goes straight towards you. Okay. Okay. And I'm going to go ahead and check your pupil dilation. You can look straight for me. Okay, pupils equal, round, reactive to light, and accommodation. Now if you can follow my pen. Okay, cranial nerve 3, ocular motor, superior and inferior oblique. Cranial nerve 4, trochlear, superior oblique, and cranial nerve 6, abducens, is intact. Now I'm going to go ahead and check for your ears. Oh, I'm sorry. If we can go ahead and check your eyesight, you were going to do the Snellen chart. So if you can stand up for me and cover your left eye, we're going to check your right first. We're going to start with this first letter, E. The second one, S, P. Third, T, O, Z. Fourth, L, P, E, D. Fifth, you can't see it? That's okay if you can.
No.
Okay. You are using your right eye, so the right Acuity is 20/50. You can cover your other side. Okay. First line.
E
Second.
F P T O Z
Fourth line.
L P E D
Fifth line.
P E G F D.
Okay, visual acuity on the left eye is 20/50. Alrighty, you can go ahead and sit down now, and we're gonna check your ears. I'm gonna go ahead and check for any tenderness. If you can let me know if you feel anything. Any tenderness?
No.
I'm gonna check the inside of the ears. Okay. Peanut, no masses, no lesions, no tenderness or discharge noted on both ears bilaterally. I'm gonna go ahead and do the whisper test. I'm gonna ask you to cover one ear. I'm gonna give you 3 words, and if you can say them back to me, okay?
Alright. What ear do I cover?
You can cover that ear first.
Red, purple, blue.
Okay, cover the other ear.
1, 2, 3.
Okay, awesome. Whispered words were heard. Now we're gonna start by going to your lymph nodes. So I'm gonna go ahead and palpate. Let me know if you feel any tenderness, okay?
Okay.
We're gonna check the preauricular, the postauricular, occipital, tonsillar, submandibular, submental, the superficial cervical, the deep cervical, the posterior cervical, and the subclavicular. All nodes were non-palpable and non-movable. Now we're gonna go on to your range of motion. So we're gonna start with you going forward and back. Now side to side. Now you're gonna look left to right. Okay, now you're gonna do the same thing, but we're gonna use with resistance, okay? So go ahead and look down. Okay, back, side, and side. Now look to the side. Look to the side. Okay, full range of motion, both with passive and with resistance for extension, flexion, lateral flexion, and lateral rotation. Now we're gonna move on to your upper extremities. If you can go ahead and shrug your shoulders for your, okay. The cranial nerve 7 spinal accessory nerve is intact. You can go ahead and look to the side. On this side. Sternomastoid cranial nerve 7 spinal accessory nerve is intact. And, okay, now we're gonna move on to your thorax and lungs. I'm going to inspect the thorax, the posterior, anterior, and lateral. Transverse ratio is 1 to 2. Now I'm gonna go ahead and palpate. Let me know if you feel any tenderness, okay? I'm gonna go under your breasts. You can go ahead and breathe in and out. Chest expansion is equal bilaterally. Did you feel any tenderness?
No.
No tenderness noted upon palpation on the anterior side. Now we're gonna check the posterior. Breathe in, out. Okay. Chest expansion, symmetrical bilaterally. Did you feel any tenderness?
No.
No tenderness noted posteriorly. Now I'm gonna go ahead and auscultate your lungs. If you have any trouble breathing, just let me know. It's gonna be 4 in the front. Breathe in. Vesicular sounds present bilaterally in all lung fields with no adventitious sounds present in the anterior side. I'm going to go ahead and check the back. Now this one has 18, so please let me know if you need a break, okay?
Okay.
Breathe in, out, in, out, in, out, in, out. I'm going to go ahead and start this one over. I need to go ahead and check under your shirt. If you can go ahead and actually take off your shirt, that would be great.
Of course.
Okay. In, out, in, out, again, Percuvascular sounds present in all four fields, in all lung fields, and no adventitious sounds present. I'm gonna go ahead and check once more in the front without your t-shirt. Stay there. Okay, and like I said before, vesicular breath sounds were present in all lung fields with no adventitious sounds present. Now I'm gonna move on to the heart. If you could go ahead and leave your shirt off. Sorry about that. Okay, I'm gonna go ahead and inspect the pericardium. No abnormal protrusions or palpations noted. I'm gonna go ahead and palpate. So I'm gonna check the aortic, which is at the second intercostal on the right side. Then I'm gonna check the pulmonary, which is at the second intercostal on the left side. Then I'm gonna check the Erb's point, which is in the middle. I'm gonna check the tricuspid, which is the fourth to fifth intercostal space on the left lower sternal border. And I'm gonna check the mitral, which is at the fifth intercostal at the midclavicular line. No trills noted in all 5 areas. Now I'm gonna check the PMI for the apical pulse. Now normally I would check for a minute, but for the purposes of this video, I will hold for a couple seconds to check the apical pulse. Apical pulse is present at the 5th midclavicular line at the 5th intercostal space. And there was no trills noted. Now I'm gonna go ahead and auscultate the heart with both using the diaphragm and the bell. Okay. The aortic, pulmonic, the Erb's, tricuspid, and the mitral. Okay, S1 and S2 sounds were present, not diminished. S3 and S4 systolic and diastolic murmurs were not present. Now I'm going to check with using the bell. Okay, aortic, pulmonic, Erb's, tricuspid, and mitral. Okay. S1 and S2 sounds present, non-diminished, with no S3 or S4 systolic or diastolic murmurs. Now I'm going to go ahead and check the abdomen. So I'm going to go ahead and have you lay down, if that's okay with you. Laying down that way. Okay. I'm going to provide privacy for my patient, only exposing the necessary areas. I'm going to go ahead and bring down your shirt, your pants a little. And I'm going to inspect the abdomen first. The abdomen is flat, symmetrical, with no masses or lesions noted. Now I'm going to go ahead and auscultate. The right lower quadrant. Right upper quadrant. Left upper quadrant, and left lower quadrant. Bowel sounds present in all 4 quadrants. Now I'm going to go ahead and percuss the abdomen in the 4 quadrants. Tympany predominant in all 4 quadrants. Now I'm going to go ahead and palpate. If you can let me know if you feel any tenderness. Feel anything? No. Any tenderness noted in all areas? Okay, no tenderness noted in all areas. Abdomen is soft and no masses noted. You can go ahead and put on your shirt back on. And I'll go ahead and remove this. Okay, I'm gonna go ahead and check your lower extremities. So if you can go ahead and sit back with your legs all the way on the chair. There we go. I'm going to go ahead and show. Okay, for the purposes. Okay. Skin is warm to touch. Skin is warm to touch and uniform in color. No edema present. And I'm going to go ahead and check. Capillary refill is less than 2 seconds bilaterally. I'm gonna go ahead and check the tibial pulse. Tibial pulse is 2+ equal bilaterally. I'm gonna check the dorsalis pedis. 2+ equal bilaterally. Now I'm going to go ahead and check for the sensory. I'm gonna keep these up. If you can let me know, if you can close your eyes, excuse me, and let me know what side you feel this touch on.
The left. The right. Left. The right.
Okay. Light touch noted in both arms and legs. There we go. Now I'm gonna go ahead and check your rapid range of motion. So we're gonna start with doing this rapidly. Okay, and now you're gonna do finger to nose rapidly. Okay, rapid movement and finger to nose. You can stop now. Sorry. Rapid movement and finger to nose touch is present and smooth. Now we're gonna go ahead and check your gait walk. So if you can go ahead and stand up and you're gonna walk forward and back. Okay. Gait is normal, hands freely moving. And now you're gonna do your tandem walk and you're gonna do going from toe to heel, toe to heel. Patient was able to perform tandem walk free from losing balance. And last test, as far as standing up, we're gonna go ahead and do the Romberg test. You're gonna have your feet together and arms pushed out the side, and you're gonna close your eyes. Okay, negative Romberg test, and you can go ahead and put your hands down. And lastly, we're gonna test your deep tendon reflex, so you can go ahead and sit down for me. And I'm gonna go ahead and, actually, if I can have you sit down on this chair right here. And we're gonna check your patellar reflex, if you can let your feet dangle. Okay. Patellar reflex is 2+ equal bilaterally. Now I'm gonna check your bicep reflex, if you can go ahead and give me your hand. And we're gonna check, sorry about that. Okay, bicep reflex. And, okay, bicep reflex 2+ equal bilaterally. Alrighty, that concludes the rest of our head to toe assessment. Do you have any questions for me?
No.
Okay, the doctor will be in with you shortly. Thank you very much. Have a nice day.
Thank you.